everyone. Welcome to our Monday Minute. We are going to discuss the implementation of OASIS-E that will go into effect January 1st of 2023. With OASIS-E, there have been some pretty significant additions to the OASIS-E document, data set is the right term. There has been a lot of realignment where there's now delineated sections of the OASIS itself, and many items that you might have thought would have been in one section are now in a different one. There are some sections that only have one or two items in that section. There are others that have multiple items within that section. While 75% of the OASIS document itself remains exactly the same as it was under OASIS-D, as far as the items themselves and the instruction for completing them, there have been a few minor adjustments to the instructions for a few of the items that were already on OASIS-D, and then multiple additions of new items. Some of the most significant additions to the OASIS-E include the completion of the BIMS and the CAM, which are basically behavioral assessments and cognitive assessments. These are pretty significant as far as your staff understanding exact application of these items and how they are to be completed. I'm not trying to paint the picture that it's going to be impossible or it's going to be difficult even. It just needs that time of education for your clinicians to include what is included and what's not included in the process of completing these items. Some of these items, especially in the cognitive section, you are to rely solely on the patient's response. You will not be able to take any caregiver input or do any research as far as a medical record is concerned. There are other social determinants of health items that have been added to the OASIS, including updated questions surrounding ethnicity, race, and preferred language. In a couple of these items, specifically ethnicity and race, if the patient refuses to respond, you will not be able to use additional input from anyone or a medical record in order to respond to that question. There are multiple OASIS items that have been added that require that you mark all that apply. Your clinicians need to be made fully aware of that. As far as PDGM calculation is concerned, no item that is used in the calculation of the PDGM HIPS code has changed in any way with the implementation of OASIS-E. And the implementation of value-based purchasing that will begin January 1st of 2023 also does not contain any items that have been changed with the implementation of OASIS-E. Most believe that one of the most surprising and significant changes to OASIS-E is the removal of over 20 items from the follow-up assessment or recertification assessment. You want to make sure that you have an EMR system that is fully updated and that when completing the follow-up OASIS assessment, only the specific items that are now required from OASIS-E are actually used in your system, or actually alerted as items to be completed. So many have suggested that it's going to take more time to do a start of care. It's going to take more time to do a resumption of care. While I am not going to deny that, I will say that it should take you a lot less time to do a recertification of a patient as far as the OASIS comprehensive assessment completion are concerned. I want to thank you all for participating today. And do let you know that Healthcare Provider Solutions has a 5-part OASIS-E training series that you can get access to through a link that we have provided with this minute. We also want to encourage you